MLE-style questions based on the text about Enterohemorrhagic E. coli, EHEC, each with 5 answer choices and detailed explanations for the correct and incorrect options. Question 1, Clinical Presentation. A 6-year-old girl is brought to the emergency department after 3 days of bloody diarrhea and abdominal pain. She recently attended a barbecue where she ate an undercooked hamburger. She has no fever. Lab studies show low hemoglobin, low platelet count, and elevated creatinine. Peripheral blood smear reveals schistocytes. Which of the following organisms is the most likely cause of her condition? A. Shigella sonnei, B. Salmonella typhi, C. Entamoeba histolytica, D. Enterohemorrhagic Escherichia coli, E. Enterotoxigenic Escherichia coli. Correct answer. D. Enterohemorrhagic Escherichia coli. Explanation. EHEC, especially serotype O157H7, causes bloody diarrhea without fever and can lead to hemolytic uremic syndrome, HUS, a triad of microangiopathic hemolytic anemia, schistocytes, thrombocytopenia, and acute kidney injury. Transmission often occurs via undercooked beef or contaminated leafy greens. Shiga-like toxin damages endothelium, leading to microthrombi formation. Why not the others? A. Shigella sonnei also produces Shiga toxin, but is invasive and causes fever, less commonly linked to HUS. B. Salmonella typhi causes typhoid fever, not US, associated with systemic illness. C. Entamoeba histolytica causes dysentery, but it's parasitic and not associated with US. E. ETEC causes watery toxin-mediated diarrhea, no blood, no HUS. Question 2. Laboratory diagnosis. A 5-year-old boy develops bloody diarrhea after a school field trip to a petting zoo. He is suspected of having an E. coli infection associated with US. Which of the following lab findings would help distinguish this strain from other E. coli? A. Lactose fermentation, B. Urease positivity, C. H2S production on TSI agar, D. Sorbitol fermentation, E. Oxidase positivity. Correct answer, D. Sorbitol fermentation. Explanation. EHEC does not ferment sorbitol, which distinguishes it from most other E. coli strains. This feature is used in sorbitol McConkey agar to identify EHEC O157H7. Why not the others? A. Lactose fermentation. Both EHEC and most E. coli ferment lactose, not useful for differentiation. B. Urease positivity, seen in organisms like Proteus, Helicobacter, not E. coli. C. H2S production, seen in Salmonella, not E. coli. E. Oxidase positivity. E. coli is oxidase negative. Question 3. Toxin mechanism. Which of the following best describes the mechanism of the Shiga-like toxin produced by Enterohemorrhagic E. coli? A. Increases CAMP levels by activating adenylate cyclase. B. Inhibits 60S ribosomal subunit, blocking protein synthesis. C. Stimulates guanylate cyclase, increasing cGMP. D. Activates macrophages to produce TNFi. Forms pores in bacterial membranes. Correct answer. B. Inhibits 60S ribosomal subunit, blocking protein synthesis. Explanation. Shiga-like toxin from EHEC inhibits the 60S ribosomal subunit, blocking protein synthesis and leading to cell death. This endothelial damage leads to HUS. Why not the others? Agonism of cholera toxin and ETEC heat labile toxin. C. cGMP starts mechanism of ETEC heat stable toxin. DTNFI release seen in LPS endotoxin response not specific to Shiga toxin. E. Pore formation, mechanism of some bacterial cytolysins, not Shiga toxin. Let me know if you want a comparison